I have the honor of introducing Dr. Francis Buadi, who is going to going to tell you everything you need to know about post-transplant approaches. So thanks, Francis. He just went on some extra exercise walk this morning, so that is good.
Good morning. Unfortunately, I couldn't come for the dinner yesterday because I got a bad cold, and I don't think you want to come to Rochester and get a cold. You wouldn't be able to enjoy the place. And so now, how many of you are transplanters? Okay. And then how many of you do just multiple myeloma? Okay. All right. That's so I think that we are still trying to find out what we need to do in patients after stem cell transplantation. And as time goes on, it becomes very difficult in any study that you do at this level to show clear overall survival benefits, which in medicine has always been the goal of using to determine whether a particular intervention is superior or not, because you want to look at all the costs involved in it. Let's see here. I don't have any, just have some research money stuff outside of that. So today, I think what we're going to look at is, we're going to look at the data on the depth of response as a surrogate for outcome. And looking at the depth of response, look at it in the post-transplant setting. What can you do to get to that initial endpoint, which may help in the long-term outcome of the patient? Because when you're seeing the patient 3 months after stem cell transplantation, it's very difficult to tell the person you're going to live for 50 years. The question is, you need something at that time to say, hey, because you have this and that, you have a higher chance of living this long. Then we'll look at maintenance therapy, and then I'll mention quality of life, because I think that is something that sometimes we tend to overlook. We look at the numbers and our graphs look very nice, but we forget about when we sit in front of the patients, the complaints they have about all the medications that they are taking.